I'm Dr Bob Gill. I'm a GP NHS campaigner, and I've recently produced a film called The Great NHS Heist about the NHS with my colleague Drew McFadden. I've had the great pleasure of being joined by Jeremy Corbyn today, and we're going to talk about the NHS, in particularly the current crisis that the NHS is facing, which is the coronavirus crisis. Hello Jeremy, thank you very much for coming and speaking to me today. Could you start by telling us about your personal experience, your family experience of the NHS?
Well, first of all, Bob, thanks for inviting me and thanks for your work in these films and actually speaking up for the principle of a National Health Service. Everyone knows my age, so I can admit it on a camera. I'm 70. That means I was born a year after the NHS was founded. My life has been the National Health Service. My aunt was one of the first nurses to qualify in the NHS, and she went on to spend her life working in the NHS and became a matron in a hospital. I remember as a child being taken to the doctor's surgery, which was in his house in our town in Newport in Shropshire. My experience was that any healthcare you needed, you got. And indeed, I was provided with orange juice on behalf of the NHS as a small child. Bottle of orange juice for each of myself and my three brothers every week. And our experience was, growing up, the idea that health was important, of course, and that your health would be looked after by the National Health Service, and the question of payment or something never ever arose. And I also remember as a child, I had measles, and I was at home for a long time being treated, and the doctor came to visit me at home. And so my experience has been, that was my formative years on it. And from that, I've got this love of the principle of the National Health Service, where we take the financial equation out, the profit motive out, and we provide a service to people. And later, I became a trade union organiser within the National Health Service for the National Union of Public Employees. And I was also a TUC appointed representative on a health board, the Enfield and Haringey Area Health Authority. And this was 1970s, and it was probably the most democratic period of the NHS. And we were dealing with the reorganisation, which I dealt with as a union organiser as well, because there were lots of grading claims and things like that. But the principle was that there was more democratic accountability than there had been at any other point in its history. And then after the 1979 election, when Margaret Thatcher became Prime Minister, I wouldn't say it was totally the start of the rot, but the whole arguments about privatisation suddenly grew, and they came out of the USA, and they came out of the right of the Tory party, Nicholas Ridley and others in particular.
Conservative Party documents from 1977, 2 years before they took office, revealed plans to privatise the utilities. Key elements were to proceed by stealth, fragmenting public monopolies, allowing the sale of assets, and the creation of separate profit centres.
Sir Keith Joseph started a think tank called the Centre for Policy Studies, and that commissioned John Redwood and Oliver Letwin, both at the time involved with NM Rothschild's Investment Bank's privatisation unit. It commissioned the pair of them to produce a prescription for what should happen to the NHS.
From 1979-80 onwards came an undermining of the NHS with the principle of an internal market. And I remember asking myself, I was a councillor at the time as well, in a local authority, why would you want to set up a market within a service? What's the point? If you're a doctor in a hospital and you're dealing with your patient and you prescribe a particular medicine for them and it comes from the hospital pharmacy, why would you need to buy it from the hospital pharmacy, and why would you need to create a whole internal bureaucracy to deal with that, unless at some point you intended that somebody else should run the pharmacy, or somebody else should run the ambulance service, or somebody else should run the social care aspects of it. And you can see from then on there's been this whole thread of the undermining by privatisation of our National Health Service.
The outsourcing of non-medical services and repurposing the NHS into a business was followed by the imposition of an internal market. Financial destabilization with private debt and the expansion of outsourcing to core service provision then transitioned in 2012 into a full compulsory external market. Hospitals now free to earn half their income from private patients. By 2014, the essential covert groundwork was completed ahead of the final phase, converting the NHS into an American-style accountable care model and privatizing control of NHS budgets.
My parents were immigrants to the country. I went to university, I paid no fees, and I qualified in 1993. And at that point, the NHS I started working in, although the work was long hours, you had this sense of you were on a shared mission together with everybody employed in the NHS. It wasn't apparent to me at the time, but already by then we had seen the outsourcing of cleaning and catering. So that family on this shared mission was starting to be broken up, and they started with the non-clinical services first because they could argue, well, that really wasn't healthcare.
This came in the 70s. I was then, as I said, a union organiser, and we would have our monthly meetings of the organising team within NUP in London, and we would go through issues that have been raised, disputes that have been raised across London. And at that time, there were two big areas. One was reorganisation and closure of facilities, which was obviously a big issue. But the other one was private contractors in NHS hospitals. And we were determined to get rid of them and bring the services in-house. And even then, there were some cleaning contracts and some maintenance contracts that were outsourced that could have been done internally. And we would see it as a point of success when a cleaning contract was handed to the NHS and the staff who were formerly cleaners for a private company would become NHS employees. And our whole mission was expanding maintenance units, so more and more work was done in-house and less was done by contractors. And actually we were quite successful at a lot of this. So we ended up with more people being directly employed and less indirectly employed. What we were probably not as aware of as we should have been was this a huge intellectual pressure from the right, which was growing from the USA on privatisation of public services.
Next big step that took place after the outsourcing was the breaking up of the NHS into the internal market. And I became aware of this back in early 90s as a medical student and then as a doctor. We had this system of fund-holding GPs, and I noticed myself that certain letters were starting to be given priority. If it had fund-holding stamped on the referral letter, somehow the medical teams were supposed to treat that better than a non-fund-holding referral. And that started to drive a wedge within a unified system where the hospital consultants worked in partnership with the GPs. What was your recollection of the internal market and what happened?
I became an MP in 1983, and I was later Vice Chair, then Chair of the London group of MPs when the London Health Service was a huge issue. We had many meetings with the Regional Health Authority before it was abolished altogether, and we went into a different system of commissioning groups and so forth. My experience of it was that bit by bit the NHS was always being told to create schemes which would render it easier to bite-size chop up the NHS into different sectors and sell them off or contract them out. And the words I used in the last election campaign were sliced up, diced up and carved up for the private sector to take it over. And this then reached its height in 2012 with the Health and Social Care Act. The Health and Social Care Act built on the principles of the internal market of the past and actually now requires outsourcing, privatisation. So the internal market was established as a long-term thing. And the arguments about the internal market were always predicated on it will be more efficient. Well, it's interesting presumptive description there. The assumption being that a public service is run with a global sum of money for that service to be run is automatically inefficient. The way you make sure public services are efficient is two things. One is make sure they're properly funded in the first place. Secondly, they are accountable.
Before the internal market was first introduced by Kenneth Clarke, the NHS was brilliantly efficient. It spent just 4%, 4 pence in the pound on administration, and it now spends somewhere between 12 and 15% in the pound. That's more than £10 billion a year extra going on running the contracting system. Money utterly down the drain.
The introduction of more management had the effect of undermining the clinical autonomy and how decisions how to run the hospital were generally clinically led by the senior doctors and senior nurses. But on top of that, and getting in the way, was this management bureaucracy, which unfortunately has been used to force through the reforms and also disempower the profession. And that's something I noticed in my career. We went from consultants being respected and determining how they ran their services for that decision to be imposed on the consultants.
Once you start to disempower the clinicians in making what ought to be clinical decisions, and you start instead to make financial decisions, you then get into some very, very questionable areas. And then it gets even worse with what are newish and very expensive medicines. I raised a lot of noise last year about Acambi, the medicine that is expensive. Yeah, of course it's expensive, but it saves lives. Why isn't it there? Well, it is there now after a campaign that was running it. But there are issues there where the NHS is being financially restricted on certain purchases, which means that the families of those patients are effectively being forced into the private sector if they can afford it. If they can't afford it, well, they're not getting the medicine.
So if I can take you back to 1997, I, for one, was full of hope with the new government, New Labour, Tony Blair came into power, and I breathed a sigh of relief that maybe some of the damage that Margaret Thatcher had done would be reversed. But unfortunately, when it came to healthcare, some of the promises that were made in opposition disappeared. What was your perspective of what Tony Blair and Gordon Brown did to the NHS?
Well, I've been in Parliament throughout all that period, and I was always and remain so totally dedicated to the National Health Service, the principle of universal healthcare free at the point of need. The party was committed to that, but was also, and this is where it became very questionable, efficiency in the public services. And Tony Blair once saying he'd tried to reform the public sector and he had the scars on his back to prove it. And this is where he met resistance over the internal market in local government and the internal market in the National Health Service. The Health Secretary in 1997 was Frank Dobson, who was a good friend of mine, and I knew Frank very well, and he was determined to A, fund the NHS properly, and secondly, overcome the local and regional health inequalities. And there are massive health inequalities. Frank therefore set up the principles of health action zones and published the suppressed Black Report, which had been hidden on health inequalities produced by the Callaghan government in 1980. Well, it would have come out in 1980, 79, 80. And he was determined to achieve improvements there and argued strongly for more money for the NHS. He got some way towards achieving that. He then was removed as Health Secretary after 3 years. What followed was a succession of Health Secretaries who brought in the principle of private finance.
It has been very prevalent, it's been very common for a health minister to leave, and then it can be a matter of months later take up a job in the corporate sector.
Alan Milburn, Patricia Hewitt, and also Stephen Dorrell, who was my Tory predecessor, they have all been working for companies involved in benefiting from the privatisation of the NHS.
Private finance was an idea that had been promoted in opposition, although a number of us, me included, strongly opposed it on the basis that it was an expensive way to borrow money. It wasn't necessary. You could use the Public Works Loans Board, or you could do straightforward government borrowing in order to pay for investment, because governments can borrow far more cheaply than you and I can. And so instead we had private finance. That meant construction companies and lots of others came into the NHS. Yeah, they did build a new hospital, and the shiny new hospitals were indeed built. The cost of them is absolutely phenomenal.
The total PFI capital investment in the NHS to date is £12 billion, and over the whole lifetime of those PFIs, the total repayments will be about £88 billion.
The adoption of PFI planted debt time bombs across the NHS. The national network of hospitals started to be broken up into foundation trusts. Public bodies are backed by the taxpayer and cannot go bankrupt. So it was necessary in 2006 to introduce new insolvency regulations, setting hospitals up for asset stripping. The Trust Special Administrator was created in 2009 and was deployed for the first time in 2012, just as the growing PFI burden caused South London Healthcare Trust to flounder as intended, so its assets could then be sold off.
And the priority on repayments overrides everything else within that hospital. And so you go to any hospital that's had a PFI contract, and you'll see where the money goes. The other thing about PFIs is they extended beyond the building into the management of the building, the maintenance of the building, the redecoration of the building, the security of the building, and everything else. And the same thing has happened in schools. I remember going to a school just near here where we are now that had a PFI contract to rebuild part of the school, and indeed the new building looked great. And I was talking to one teacher in a class and I said, "How's it going?" And he said, "Oh, great." I said, "Anything you particularly need?" He said, "Yeah, a new desk." I said, "Okay. Well, why are you asking me about a new desk in your classroom? Why don't you call the school keeper and get him to bring you a new desk in?" He said, no, I've got to go to the management company in Manchester to see if they approve of the cost of the new desk. And if they do, I'll be then sent back where I've got to order it from and when it will be delivered and if I need it or not. I said, "You must be joking." He said, no, it's absolutely serious. And he then showed me a whole trail of stuff where he'd been refused a new desk. This is madness. This is what happens when you give up on the principle of running a public service and say the principle of public service becomes secondary to the financial interests of those that now own and run those buildings. And PFIs in our hospitals are a complete menace. PFIs did come in during the period of the Labour government, the new Labour government, and I was opposed to them, and indeed so every time this is thrown at me by the Tories, I said, whoa, 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 whoa. There were many of us that did not agree with that and never would. And so I was determined that we would fight and win an election on the principle of, actually the very traditional principle of direct funding of public services. And when a new building is required, and new buildings are required, you pay for it through either in the case of local government, usually the Public Works Loans Board, and you pay for it through the NHS centrally. The other, I'll just finish on this, other perverse side of it is that in order to make ends meet, the hospitals are encouraged to make the most of their estate. Therefore, they sell off land, sell off places, sell off opportunities for development in the future, and instead lease property in the private sector, which is then, of course, a huge cost. And the NHS has lost the capacity to improve its services within its own existing estate.
The NHS is not for sale, and it never will be.
Just to stick with the Blair-Brown years, there are two things I feel are worth mentioning. One was, for the first time in NHS history, the contracting out of clinical care with these independent sector treatment centres, which effectively sucked out, cherry-picked the easy, profitable work out of the NHS, further destabilising the NHS.
Pharmacies and things like that, yeah.
And operations, cataract operations, hip operations. Not only were we paying more for the private sector to do it, we are also removing training opportunities for the younger doctors. So that was one really wake-up call for me, that Labour was not living up to the traditional, their role of defending the NHS.
And when we objected to this, we were told, well, actually it means people will get operations more quickly because they'll be done in the private sector. And, well, yes, it is only a valid argument if you're not at the same time trying to expand the public sector to take over that issue. The other way you could look at it is this is direct subsidy to the private health market by putting NHS patients in there to be treated, and this has now become just a norm, that most hospitals would contract out whole areas of service. MRI scans, special treatments, and so on, would all be contracted out to the private sector. Therefore, you don't need a fully funded NHS because they can send it into the private sector. And it then destroys the whole principle of that community of work within a hospital. I mean, the traditional hospital where from the manager, chief executive, doctor, consultant, and so on, cleaner and everybody else are all working with the NHS. You're not in competition with each other. But if person A works for the hospital, person B works for Virgin Health, person C works for somebody else, and so on, you've lost that ability to manage the whole thing. And particularly at a time of an emergency, you need people to be flexible. People to be flexible and go beyond their own job in order to help out in an emergency. Isn't that what it's about?
And the fundamental duty of a private company is to maximise profit. And the way they will do that is to do the profitable work and leave the unprofitable work to the NHS, and also to cut corners. And we saw with cleaning the infection rates in hospitals going up.
How many private sector A&E departments are there?
High risk, no profit. Hardly any.
I don't know of any, actually.
No. We had the emergence of New Labour. There was a change in the name. But there was also a change in philosophy, away from socialism to neoliberalism, the market being the force to achieve social change. What was your view on the change that took place?
Blair came in and had a different approach in that he did not want to bring anything into public ownership particularly, did want properly funded public services, but was unspecific about how they would be funded, and then came in to encourage and develop the internal market in local government and in health, and use the argument about private finance to provide for the new buildings that were needed. His view was that we can borrow money easily from the private sector, they know how to do things, and they can build these buildings more quickly than the public ever could. There seemed to be an underlying assumption that somehow or other anything that's public service is automatically wasteful, expensive and inefficient. And as a former public sector union organiser, and indeed I was a local councillor in North London, in Haringey, I was actually very, very well aware of how efficient the public sector is, how it does far more for less than any other, because there's no profit motive involved. Jumping forward a bit, my local authority here in Islington, the Borough of Islington, has taken most of the formally contracted out services back in-house in the public sector, and they've found two things. One is they're more efficient, and secondly they're cheaper. The arguments put against us was, do you want us to be in government raising taxes when we said we wouldn't, in order to construct all these new buildings and expand services? And we said, well, it isn't a question of massive tax rises, it is a question of how you fund the public services. And by funding them through the private sector, you're actually creating a bigger debt off the books for the future. Because of course, a PFI debt does not show up as the public sector borrowing requirement, it shows up as a book debt for each hospital, each school. So, well, that's not good. And then we went further as a government. In the case of the DWP, they sold off job centres, then leased the same building back. So a building that was formerly publicly owned is then sold to a property developer who then happily leases the whole thing back for 50 years to the public sector. And so they've paid a sum of money for a building from which they've got a guaranteed income. And what have we done as a public? Lost our resource and have to pay for the privilege of losing it.
It's a simple transfer of public assets out of public ownership and control into the private sector, where they can generate ongoing income. If I return to something I think was particularly damaging to general practice, in 2003-04 we had a new GP contract, which after years of financial squeeze seemed quite appealing to GPs at the time. They were able to opt out of hours care, which later on was handed over to the private sector. But also it created a two-tier general practice. So you had GP partners versus salaried GPs, and unfortunately the salaried GPs got exploited. So we lost the moral high ground when, as we're seeing now, the private sector is creeping into running GP surgeries. So the principle was lost, but also we became, the GP's income became less dependent on their list size and more conditional, satisfying other targets. So we've introduced a mechanism whereby the government can squeeze the income of the GP, dangle carrots and sticks in front of them in order to make sure they go along with subsequent privatisation.
I think there's a great deal in that the GP contract of that time, at one level, did improve the income of GPs, and it was probably very, very attractive to them. But in the end, it actually damaged the NHS a great deal. It then goes wider, with clinical commissioning groups handing the whole GP practices over to a private healthcare group, so Virgin Health or others come in and run the entirety of it. Most people that go into medicine as students go into medicine for all the best reasons. They want to help people, they want to look after people, they want them to have better health. They go in because they have a passion and it's a vocation. And they end up being told that the way to go forward is to become a businessman running a GP practice.
Moving on, we then had the 2008 financial crash, change in government in 2010. You would have thought that might have been a time for politicians on the right to reconsider their dogma and ideology about the market and deregulation being the answer to everything. Yet then we were faced with this monumental reorganisation, the Health and Social Care Act 2012. Could you talk about the whole austerity programme and the 2012 Act?
Yeah, the financial crash driven by global financial pressures happened in 2008. The government of the day, Gordon Brown was Prime Minister, dealt with it by pumping liquidity into the system, by quantitative easing at massive levels in order to continue the running of the economy. And after that, we had the general election of 2010, in which the coalition government came in. Their solution was that we had now increased the levels of public debt and public borrowing, which was true, we had, in order to deal with the financial crisis. The financial crisis had kept the banks going, had bailed the banks out, had subsidised the banks, and their solution wasn't to keep the banks in public ownership, but to put them back into the private sector, most of which they did, not all, but most. And at the same time introduce an austerity budget in 2010, which cut spending for local government, cut spending for the NHS, cut spending for those in receipt of DWP benefits, and cut capital spending by the government. What's the result? Greater debt, greater deficits, and lower levels of employment and lower levels of wages, and therefore lower spending power in the economy. It was a wholly wrong and depressive move. And the NHS was then encouraged through the Health and Social Care Act, which was presented as dealing with the crisis in social care and health, to encourage them to privatise whole swathes of the NHS by setting up local clinical commissioning groups that were led by GPs. So you had GPs who were legally independent of the NHS but contracted to the NHS, running the local services and deciding what hospital contracts there would be, where you would send specialty cases to from within your local area. So if you had a case where you wanted specialist cancer treatment, which hospital do you send it to? And those are big decisions, and they involve an awful lot of money. And inevitably, the private sector became more and more involved, £10 billion going into the private health market through the NHS. And so we do have a massive health market in Britain. Taking it forward a bit, trade talks with the USA absolutely clearly do involve access to our NHS market. That is what they're after.
There's no privatisation of the NHS on my watch, and the integrated care contracts will go to public sector bodies to deliver the NHS in public hands.
Look, I think everything with a trade deal is on the table. When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that, but everything will be on the table, absolutely.
The Health and Social Care Act also broke up the NHS into what Alison Pollock describes as the equivalent of multiple insurance pools, using public money within a clinical commissioning group as replicating an private insurance pool. And the thing about the GPs being in charge, well, that was a persuasive narrative. The reality is the GPs didn't have the skill sets to be making these decisions. And on the whole, you had the entrepreneurial GPs dominating the clinical commissioning groups. And we've seen since then that the clinical input on the boards has been diminishing, whilst the more managerial and financial power of decision making has taken over.
I think back to when Griffiths and his report came in about alleged deficiencies in the NHS, and I think back to the days that I was on an area health authority. We were local councillors, some local businesses, local trade unions, and usually somebody from the Department of Health, and we would make our decisions on the basis of clinical needs. We were very much clinically led. We had consultants and doctors there with us, giving us advice of what they thought should happen, and we made those decisions in that way. We weren't told to make a profit. We were told to make sure the health of our community was better. So we spent more time poring over the entrails of the Public Health Officer's report every year on mortality rates and infant mortality rates and morbidity rates and smoking, cancer, all those issues, than we did anything else. I don't think they do these days.
No, and I think the point I want to bring out with the Health and Social Care Act is this is a transition, and a transition to a fully privatised system where, as we saw in a recent report in the Sunday Mirror, the company United Health and their subsidiary Optum is now charged with finding ways and restructuring the NHS and getting entwined in the mechanisms of handling the budgets. And the case our film makes, it presents the evidence for the end game, which is a US-style system, a two-tier system where you will get basic services, if available, funded through the taxpayer, and everybody else, if they want to get anywhere close to what the NHS used to be, will have to take out top-up insurance. And that's the whole purpose of that Health and Social Care Act. It had nothing to do with improving efficiency or being clinically led. It was a transitional phase to take us to the US-style system. What are your views about what you saw presented and what you've found out about the trade talks in terms of the real threat of the US takeover?
I've always been very suspicious of the trade talks. Now, I've been all through all the Brexit issues over the past 3 years. And I've had many meetings with the European Union on all this. And whilst there are criticisms of the EU for allowing too much privatisation, indeed through the rail package encouraging privatisation, they also have quite clear perspective on what public services are and what public services should do. The US perspective is a very different one, and this government is pledged to a trade deal with the United States and at the same time have a trade relationship with Europe. Well, the cultures of doing business and doing public services are so wildly different, it's hard to see how you can have both at the same time. And during the election campaign, I was able to demonstrate by producing documents that had been given to me that the British government has for 3 years been in negotiation secretly with the US on what would be the heads of agreement on a future trade agreement. President Trump let the cat out of the bag at one point when he said that the health market had to be on the table. And the documents that I revealed during the general election campaign revealed they'd been absolutely involved, not just in NHS, but in all aspects of public markets. Now, if you think what are the public sector markets in Britain, NHS is the biggest, local government, education, administration of public services like Department of Work and Pensions, Environment Agency, you name it, all the way through. There are huge areas which you could say could be a market opportunity. And I exposed all this in the election. Boris Johnson kept on saying there's no way we'd ever sell off the NHS, there's no way we're going to do that. So I said, well, if that's the case, why are the talks going on? You haven't stopped the talks, you've known about it, and you're clearly very well aware of it, so why haven't you stopped them? They're just exploratory talks. I said, well, why have you not ruled out the NHS from them? Why have you not ruled out public services from them? So, well, it's what the Americans want. The Americans went on to say this was for them a red line. There will be no advantageous trade deal for Britain to export whatever goods we want to, manufactured goods, farm goods, whatever it happens to be, to the USA, without them having access with investor protection in to the UK market. And so I raised this in the general election campaign, and the mainstream media in Britain then gleefully reported a few days later this was all a Russian plot. A Russian plot to apparently give me documents that weren't really real in order for me to reveal them. I mean, it's quite a complicated Russian plot if it is a Russian plot, and I'm struggling to understand how this is absolutely a plot. What I do know is those documents are correct, those documents are accurate, and the government has been, and wants to continue to be in talks with the USA to give private healthcare companies from the USA access to our NHS. And that is very, very dangerous.
The insurance industry has contributed the man who now heads the NHS, the independent NHS, which takes very little instruction from government. And that man is Simon Stevens of the American insurance company United Health.
Simon Stevens was the the guy who was president of United's global operations. These are very big parts of these big corporations that are not widely understood. And they're looking to see how they can get enmeshed into the healthcare systems of other countries. The UK in particular, they've had a presence in the UK for many years. They operate behind the scenes. They're usually behind the scenes consultants to the Prime Minister or someone in his or her cabinet to advise them one way or another. And of course, if they are coming out of a big for-profit insurance corporation in the US, they have a bias.
So we have the 2012 Act, which forced the whole NHS to be outsourced to private contractors. We have in charge of the NHS now a man called Simon Stevens, whose last job before he was appointed as chief executive to the NHS was in charge. He was president of global expansion for United Health. In his the NHS 10-year plan, he sets out, although in coded language, how he's going to reconfigure general practice and almost force and maneuver general practices into primary care networks, and also new legislation to allow private sector monopoly within the NHS, to remove Section 75, which at the moment allows for public open procurement, open to scrutiny. By removing that element, which is no longer necessary for them, we will have everything necessary in terms of budgets being pulled and legislative hurdles removed to reproduce the American HMO, Health Maintenance Organization model, which is fundamentally based on maximizing profit, and one main way they do that is through the denial of care. This will be a catastrophic progression of the privatisation, in my view.
Well, it will bring in the private sector to make a lot of money out of the NHS, and will also mean that, like it or not, GPs, consultants will be required to make clinical decisions based on financial imperatives, what you can make most money out of and what you can't.
The American health insurers are already here. Since 2003, United Health Group, and through its subsidiary Optum, has been awarded NHS contracts across England to provide prescribing decision support software, management of GP referrals to hospitals, and crucially, to implement policy to redesign the NHS. United Health Optum is ideally positioned to capture control of NHS budgets allocated to GPs via their registered patient lists. Most doctors remain unaware of the privatisation plan for the NHS, which, remarkably, is fully endorsed by the British Medical Association.
Coronavirus 19 has actually changed an awful lot of perceptions. Suddenly, everyone realises that a group of people who lead a marginal existence because they live and work in the gig economy have difficulty surviving, therefore have to go out to work. They're not deliberately doing it, but they'll be forced to go out to work whilst they're carriers of a disease that is potentially lethal to a small percentage of the population, because of the economic injustice in which they have to live. So suddenly, the whole country wakes up to the view that 10 years of austerity has brought us this injustice, this inequality, and it's actually dangerous.
And I think the same people who thought maybe looking after number one, opting out and taking out private insurance in some way protected them. Our experience and speaking to colleagues in America, it is clear that having private insurance is no guarantee of having medical care. So if your medical bills become very expensive, the insurers look for reasons to drop that provision. And they are continually denying cover to the sickest of people. So you have a system which actively avoids sick people pretending to be a health system.
I raised this with Obama. He came on a state visit to London in the year he was stepping down as president, and I had a meeting with him. And I said, I want to congratulate you on extending healthcare, which he did. to some extent through extending Medicare. And he said, that's very kind of you and very generous of you, but it's not deserved or justified, because my biggest failure is I was unable to bring in a health system that actually guaranteed all Americans healthcare. He wasn't talking about necessarily a national health service. And he then went on to say how impressed he was with our national health service.
It's quite perverse. At the very moment where public opinion and momentum is getting behind a Medicare for all model in America, moving closer
Which
to...
Which isn't an NHS, because it's actually Medicare through the private sector, but it is the principle of public provision of health.
Public funding, private provision, removing the unnecessary private insurance bureaucracy and all their CEOs and shareholders, removing them out of the equation. At the very same time, we are running headlong in the direction that the Americans want to abandon. You couldn't really make it up.
The insurance industry will tell you, they'll cite statistics that they pay for well over 90% of all the claims that they get. The reality is that's probably true, because so many of them are fairly small and routine. But a lot of the ones that are denied are the ones that cost the most money, or the treatment costs the most money. It could be cancer care. It could be a liver transplant. A lot of the people who got their policies canceled by the insurance companies, by the way, before Obamacare, before the Affordable Care Act was passed, were women with breast cancer. And the insurance companies would review their files and come up with some phony reason to avoid paying for their care. You've got to realize that these companies are in the business to make money.
The impact of austerity, we've had 17,000 bed cuts in the NHS since 2010. We've had the assault on the terms and conditions and pay of NHS staff. We've had the appalling treatment of NHS workers who come from the EU. We've had a brain drain. We've lost talent from the NHS, leaving a big hole, 40,000 nurses, 10,000 doctors. And we are now meeting a very severe challenge. We have half the number of beds compared to the Italian intensive care units. We've got half the number of beds they have to deal with the coronavirus. We've lost so much capacity within the NHS, and morale is rock bottom. They don't even have basic protective equipment. They're being put in harm's way. They're not even being given tests for coronavirus. So in terms of how the NHS has been weakened and the complete disrespect, disregard for those people trying their best under difficult circumstances, it's really upsetting for somebody like myself who's been trying to warn people of the crisis within the NHS that was brewing, to now meet this very potentially deadly challenge of coronavirus.
Coronavirus has woken an awful lot of people up. I've been phoning around colleagues today around the country about coronavirus, because obviously my team, the Shadow Cabinet, are totally on it. And the fundamental principle we're putting forward is that it's the inequalities that are now being shown up, and therefore the government must guarantee income protection for workers as well as proper funding for the NHS. And that means that they've got to recognise that 94% bed occupancy means within a few days we're on 100% bed occupancy. I've heard of places around the country that have got no more beds at all, none at all, to deal with anybody. And so we're into a crisis where the only thing to do is take over the private health sector and use their beds as well. I've got no problem with that, that should be done, but take them over and use them. But it's also a big lesson and a big warning. If we had an atomised, broken up, privatised health insurance model in this country, how would it cope with something like this? Matt Rack, the General Secretary of the Fire Brigades Union, was talking to me yesterday. I had a conference call with him and others about the hazard warnings that were done 12 years ago on what are the threats to our society. And one of them was a global viral epidemic. When I asked the Prime Minister how much testing's going on, I was told that there had been 40,000 tests undertaken. That doesn't even meet a percentage of NHS staff, never mind all the other tests that should be undertaken. And the point I made was that every NHS employee, every care worker has got to be tested. The World Health Organization message is test, test, test. South Korea did that. South Korea tracked it very quickly and appear to have got on top of the crisis rather more quickly than the European economies have managed to do. And so an NHS that A, can't even test all its own staff. And then I had a number of doctors onto me, hospital doctors, nurses onto me, the various NHS unions onto me, all saying they wanted full hazard gear, protective wear. It's not available, it's simply not there. And then you go on to ventilators. There is a great shortage of ventilators, and there's an even bigger shortage of people that know how to use them. You can't train everybody overnight. That's the whole point of having a secure health service for all of us. We've so cut it back, we've so divided it up and privatised it. This has got to be the biggest political warning ever.
The first time in my life I became, let's say, an activist, it was because of the threat to Lewisham Hospital. We'd already suffered the downgrading of my local hospital, Queen Mary's, and I couldn't really understand because I'd seen the deterioration in care for my patients. And it made no logical sense to shut down yet another A&E and lose acute beds and maternity unit. But there was a feeling within me that I may be taking a professional risk. But it got to the point where I could no longer keep quiet. Now I know there's a culture of fear within the NHS. People are very reluctant to speak out. In fact, we know the treatment of whistleblowers in the NHS is very poor. That's an understatement. They are actually intimidated, forced to sign non-disclosure agreements. There are multiple levers that the employing trust can use to silence what the public needs to know. And we are not getting a true representation of the degree of crisis that the NHS is facing. The media don't present it. Certainly the government won't present it. What do you say to doctors and nurses who feel compelled to speak? How can they get their word out without being suffering some detriment in some way?
We have to support them and protect them, and surely the message is that the doctor in Hubei province in Wuhan that first identified corona was himself suffering from it and sadly died as a result of it, and has had a hero's funeral from the people because they recognised he was a hero in standing up to explain what was happening when those in charge wanted to deny it. I think we have to support and defend whistleblowers, and there is some legislative protection for them. It's not adequate and not enough, and it's too easy for employers to identify the individual and give them a hard time or get rid of them altogether afterwards. So yes, of course they must be defended, but it is about campaigning work, and I'm so pleased that you were involved in that campaign on Lewisham. I was involved at the same time in the campaign to defend the Whittington A&E, and we indeed had meetings where your speakers came to our meetings as an issue of solidarity. We won the campaign on the Whittington, we saved the A&E from closure, the hospital is still there, and last year it dealt with just slightly shy of 100,000 patients through the A&E department. Now, had that A&E closed, where would they have gone?
It would have put immense pressure on remaining hospitals.
It would have put the pressure on UCH, on the Royal Free, on the North Mid, who themselves had record numbers last year because various issues, and now coronavirus means that there's going to be an awful lot more extreme cases of coronavirus that get into hospital. Most cases are not going to get anywhere near a hospital. Now, if people recover, good, but the hospital's got to be there.
And yet still we have a programme of reconfigurations, to put it politely, but these are cuts and closures. I'm involved in other campaigns, for example, the Keep Our St Helier Hospital campaign. There is a consultation, which is really just a paper exercise in my view. It has no statutory power to stop these things. The government is pursuing these cuts and closures as we speak. What message do we give the government? They should be learning from coronavirus. What do you say to government with these ongoing cuts that are planned?
Stop the cuts, invest properly in our NHS, and you know what? When you get rid of PFIs and get rid of the private sector out of the NHS, it'll be a better service, it'll be more efficient, and it'll be cheaper. It's been really interesting talking to you, and thanks for all that you've done and do and will do. You've obviously studied this in a way that few others have, and from a different perspective. How do the rich fare under healthcare in different societies?
There are perverse incentives within a privatised system. First of all, the insurers do not want expensive patients, so you may fear the loss of your cover if you become sick and expensive. Secondly, the private hospital providers are incentivized to do things that are unnecessary. You may be having investigations exposed to radiation, have unnecessary scans, or even operations that you don't need. Within the NHS, those perverse incentives do not exist, and people who think they can just make their own arrangements and look after themselves need to think again, because what I treasure most about the NHS and working in the NHS is I do not have to look at the patient in front of me and ask myself, does he have money? Can he afford to pay me? That burden has been removed, and it's only with the threat of losing the NHS that I've come to appreciate how important that is.
Health checks, not credit checks.
Exactly. One example that springs to mind is the case of Health Corporation of America in Florida were found to be performing heart procedures on people who didn't need them. In fact, 50% of the people who had the procedure had it unnecessarily. So in effect, they were not only committing fraud, but grievous bodily harm and subjecting these people to unnecessary clinical risk. And that's the situation we must avoid in this country.
And once you create a system where you get a market reward for doing something, then that will happen. I mean, that's the kind of thing that happens when if you don't know much about cars and you take your car to a garage, they do a lot of unnecessary repairs on it because you don't know anything about it. Well, that's pretty bad with the car, but it's even worse with your body.
The byproduct of that is a complete decimation of the trust between the doctor and the patient, which is fundamental to operating good, safe, clean medicine.
I like the idea I can go to my GP, I know them all in the practice, and they're going to honestly tell me their opinions. And there's no other motive there other than my health. That's how it should be. Can we just be proud of our NHS and the principles behind it? Those people that met, marched, walked in the 19th century and early 20th century with the dream of a society that gave free healthcare to all, and we removed the fear, the financial fear of being ill. None of us want to be ill. Yeah, of course we don't. But the idea that you can get treatment free at the point of need because you need it is a hallmark of a civilized society. Those that are trying to grab and destroy our NHS, they should be ashamed of themselves.
Thank you very much. Thank you for your time, and it's been great meeting you and talking to you. I'm Dr Bob Gill. I'm a GP NHS campaigner, and I've recently produced a film called The Great NHS Heist about the NHS with my colleague Drew McFadden.